Welcome back! In today's video, we're going to be talking about vortioxetine, also known as Trintellix. And this is in response to one of our viewers who asked us to make a video specifically about this medication. If you would like us to make a video specifically for you, drop that in the comment section below and that video will be coming your way. So, in this video, we are going to talk about the top 5 things that you need to know about vortioxetine. Starting with number 1, what is vortioxetine? Well, vortioxetine, also known as Trintellix, is an antidepressant, but it's not your typical antidepressant. It has multimodal action. What that means is that it has various actions on different serotonin receptors and transport systems, which lead to increased serotonin, norepinephrine, dopamine, glutamate, acetylcholine, and even histamine. This is why vortioxetine boasts pro-cognitive effects. It has been shown to improve cognitive symptoms such as lack of memory, lack of focus, lack of attention, and even processing speed. And it has been shown to do this better than any antidepressant on the market. It is superior in performance in processing speed, psychomotor speed, executive control, and cognitive control. It did tie Cymbalta or duloxetine in delayed recall or improving delayed recall. And very specific to vortioxetine is in a 2021 study where they took patients with mild cognitive impairment. So this was an elderly population with a mean age of 70 years old that had just mild cognitive impairment without depression. And it showed that in 1, 3, and 6-month follow-ups that they had significant improvement in their cognitive symptoms. And by the end of the study, those participants had a return to normal cognitive function, which is absolutely amazing. So does vortioxetine make you smarter? Well, it won't exactly increase your IQ, but if it helps to improve your memory, your attention, and your processing speed, it's going to make you feel a whole lot smarter. So what is it used for? Well, it was FDA approved in 2013 for the treatment of major depressive disorder in adults. It is also used off-label to treat generalized anxiety disorder. It is also used adjunctively to other antidepressants to treat specifically those cognitive symptoms of depression. You see, when you have major depressive disorder, one of the symptoms you may have is lack of focus, lack of attention, and a brain fog. And some patients will even have pseudodementia. This typically happens in the elderly. And so it's also used to treat geriatric depression because it can help improve and eliminate that pseudodementia or those memory impairments that show up in the elderly when they have depression. So how long does it take for it to work? Well, it typically takes 2 to 4 weeks at a therapeutic dose of 10 to 20 milligrams. And if it's not working by 6 to 8 weeks, then you may consider switching your medication, of course, under the direction of your provider. So is vortioxetine addicting? No, it is not addicting. It doesn't cause dependency. And due to its long half-life of 66 hours, the incidence of withdrawal or abstinence syndrome that you can get with multiple medications, including antidepressants, is actually lessened. But it is advised that you still want to taper off of the medication slowly. But with this medication, you can typically taper off more quickly than with other antidepressants that have a shorter half-life. And so what are those side effects and those drug interactions? Well, when you're looking at the side effects, always remember that these side effects are transient and typically will resolve after a week of taking the medication. We have serotonin in our gut, and so most of the side effects with any antidepressant that is stimulating serotonin is going to have effects and the impact of the serotonin in our gut. And so the most common symptoms you're going to see are going to be nausea, diarrhea, dry mouth, and dizziness. There is also a report of sexual dysfunction of 16 to 34%. However, please note that the placebo effect of this side effect was also relatively high, and the reports were 14 to 20%. So take that for what it's worth, but from my experience, what I've found is that if patients are experiencing any type of sexual dysfunction with an SSRI and we switch to vortioxetine, it typically is resolved. And another thing about vortioxetine is that there is no significant effect on body weight. A lot of antidepressants get a bad rap because they cause weight gain, when in fact they don't cause weight gain. The pill doesn't come with calories. However, because of some of the way that it's affecting serotonin, it can increase your cravings and impact your hunger hormones. And so therefore, that's how they cause weight gain. However, Trintellix, because of its multimodal action, it actually has been shown to have no significant impact on cravings, which means people aren't gaining weight. Now, as with all antidepressants, there are those rare and dangerous side effects and black box warning that I talk about in the video that I made about the top antidepressants used for major depressive disorder. So that also holds true for vortioxetine. And so when we're talking about drug interactions, you have to keep in mind that vortioxetine is mainly metabolized by the CYP2D6 substrate. So any inhibitors or inducers of that substrate taken with vortioxetine are going to require some adjustments in your dosing of vortioxetine. You also want to avoid concomitant use with those MAOI antidepressants because that will put you at a significantly high risk for serotonin syndrome. So you want to avoid it 14 days before or 21 days after taking vortioxetine. You don't want to take any type of MAOI medication. And though it can be used adjunctively with other antidepressants, it must be done very cautiously because of the risk of serotonin syndrome. And this includes all medications that can increase serotonin. It's not just antidepressants that can do this, but there are pain medications that can do it as well, such as tramadol, triptan medications for migraines, tryptophan, which you can get over the counter in a supplement, and even St. John's wort. Any type of supplements that will increase serotonin are going to potentially impact and increase the risk of serotonin syndrome when taking it with vortioxetine. Caution should also be taken with blood thinners, and this includes aspirin and ibuprofen or any non-steroidal anti-inflammatories because there is an increased risk of bleeding. That's why it's important to let your provider know all the medications and supplements that you are taking. So that's it. That wraps up the video on the 5 things that you need to know about vortioxetine. Is there anything that you would like to include in that list? Drop it down in the comment section below. I'd love to hear about it, and we learn from sharing each other's experiences. I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you next week.